Hi, my name is Keitha Mccaughey. I was born in Jasper, Texas. My father was in the military for 30 years, so we lived in a lot of different places, including Paris, France. Because we moved around so much, I've had an opportunity to get to know people from different cultures and all walks of life. I embrace the diversity in human beings and love to learn about how many ways we're the same. We all strive for security, love, comfort, and acceptance. I have 2 children, ages 34 and 26, and a grandchild on the way. I love animals and try to rescue as many as I can. My heart breaks for anything that I perceive to be helpless or in need. I've been a nurse for 19 years and have worked in rehabilitative nursing, the float pool at St. Elizabeth Hospital, and presently as a wound care nurse. My sister's been a great influence in my life. She became an LVN several years before me and gave me encouragement and the means to go back to school. She made me believe in myself because she believed in me. I've studied really hard to make sure that that belief was not unfounded, and I hope I'll always make her proud. A year and a half ago, I was a victim of the flooding that occurred when the floodgates were opened at Toledo Bend Dam. My family lost our home and everything in it. We were uninsured because our house set up high enough that it never should have happened. The important things that I learned from this are that nothing can ever take away your education, and that I have a wonderful family and friends. I learned to practice safe and effective holistic patient-centered care to varied patients in multiple settings from a global perspective by incorporating theories and evidence-based findings through my nursing inquiry and evidence-based practice class, statistics, nursing theories, and online education classes. I also made use of my comprehensive holistic health assessment class for this construct. I learned to identify abnormal data, both objective and subjective, develop nursing diagnoses associated with identified problems, interventions, rationales for interventions, short and long-term goals, and determining if a long-term goal has been met. I was exposed to nursing theories like Roy's adaptive model, Newman's systems theory, Nightingale's environmental theory, Gene Watson's caring theory, the modeling and role modeling theory, and many others. I completed a paper by choosing an objective from the list of Healthy People 2020 website. I wrote an assignment using my area of practice as a backdrop and seeking out policies and procedures already in place to support the issue, then attempting to add to this with my department director. I chose neuropathic treatment and improved on our current policy for treating patients by adding possible vitamin D and B12 supplementation to our program. I was required to write a philosophy paper causing me to examine my own values and finding which nursing theory was most suited to my style of nursing. The statistics class taught me to determine how accurate data is when reading studies related to healthcare subjects. I also believe that part of the Humanity Society construct was met through my class on nursing practice, care of communities, where I produced a community project that required finding a particular site and noting what hazards were involved and what type of effect they have on the community, and what, if anything, is being done about it. This was an eye-opener, as I found that living away from chemical plants does not make the community free of chemical hazards. I feel I met this construct at 100%. For the Lifespan Health Continuum construct in the Nursing Practice Care of Patients with Compromised Multiple Health States class, I turned in an assignment for theory-directed holistic care for the compromised patient, the application of a patient memoir. I read a book written by a patient who was ill from their perspective and then described the pathophysiology and disease process. I focused on a particular problem that they wrote about and then chose a nursing theory to apply using goals, interventions, and outcomes. The book I chose was Heart of Iron, My Journey from Transplant Patient to Iron Man. It inspired me to believe that anything is possible and to push everyone to take an active part in their own health care. When my mother fell and broke her neck, multiple bones in her face, had a concussion, and ultimately a seizure, I utilized what I had learned here to formulate a plan to help her overcome the many health issues she already had prior to the accident, as well as those incurred with the fall. My mother has since recuperated, works out with weights, walks 5 miles a day, and is off of almost all medications. A recent visit to her cardiologist, whom she had seen for years, brought surprising news. She no longer has any heart disease. Every one of my patients is something to someone. They all matter, and they all deserve a chance to thrive. This program has taught me how to tell good information from bad, while still taking advantage of the internet to put together information to improve the situation of the people I'm caring for. I feel I met this construct 100%. In meeting the construct to synthesize clinical judgment in nursing practice utilizing critical thinking, nursing process research, and evidence-based practice, I found the Nursing Inquiry and Evidence-Based Practice class beneficial. I chose an article detailing a quantitative research study from a nursing journal. I then wrote a paper critiquing the article. Throughout all baccalaureate courses, I've continued to become more proficient at using computers and the internet. This class taught me to check validity and reliability of studies, as well as the ability to understand the leap from theory and research to evidence-based practice. I can use all information available that is pertinent to the nursing decision-making process and formulate a viable plan for the clinical care of a patient. Discussion questions throughout the baccalaureate program have caused me to investigate many new subjects using printed media, the online library, and the internet, as well as having classmates provide me with food for thought. I feel I met this goal, this construct at 100%. I feel that I employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients, clients, /clients, and members of the intraprofessional and interprofessional healthcare team because I completed the nursing practice, leadership, and management in the healthcare system class. I submitted a clinical application assignment which helped me learn to utilize nursing management skills to bolster my confidence in approaching educated peers for collaboration. I realized that having the cooperation of all modalities and available resources within the patient's grasp will accelerate healing and encourage complete health from all angles. I feel confident to wade through the myriad of studies and statistics because I participated in discussion questions in the Nursing Inquiry and Evidence-Based Practice class. I was required to learn about the U.S. healthcare system and the specifics of services available. This has been a game changer in my practice because it made me aware of the additional challenges that patients face when trying to obtain services to facilitate a normal health state. I've met the patient/client-centered care construct at 100%. I am able to differentiate multiple role dimensions and practice within ethical, legal, and regulatory parameters while caring for patients/clients as a member of the intraprofessional and intraprofessional healthcare team, as well as the ability to demonstrate professional integrity, effective communications, active inquiry, and service to the community because, as part of my synthesis of professional nursing class, I was required to read Professional Issues in Nursing, Challenges and Opportunities. I also wrote a DEC paper for my nursing theories and online education class, which dealt with the regulatory, legal, and ethical issues that a competent professional nurse would use to promote patient safety. Through this assignment, I was made aware of the role of the associate degree nurse versus the Bachelor of Science in Nursing degree, using the DEC competencies in a particular scenario. I truly feel that all my baccalaureate classes have had a hand in shaping who I've become since beginning this journey. No one class or assignment was solely responsible for a particular construct, but throughout the process, taken as a whole, I've learned much, grown immensely, and been truly humbled to realize how little I knew in the beginning. I've met this construct at 100%. Once I get my baccalaureate, I will again be eligible for the ladder program at St. Elizabeth Hospital, and I will take full advantage of the additional pay. I will accomplish this within the year. I have plans to attend the WOCN conference in Philadelphia in June of 2018, and will seek full WOCN certification in addition to my CFCN status within 2 years. I will be starting a mentorship program for high-risk girls beginning in junior high school using successful career women as mentors and role models to help cut down on teen pregnancy and drug abuse. I will do this in the next 3 or 4 years. I will continue to work in my current position with an eye on becoming a nurse manager at my hospital or another facility within the next 5 years. I also would like to head up a program that encourages good nutrition and exercise as a means to reverse chronic disease and cut down on the loss of healthcare dollars to preventable or reversible problems. I hope to make a difference for somebody.